So the first thing I'm going to ask you to do is to stand up.
Okay.
And I'd like to see if you can walk. Ooh, are you okay?
Yeah, it's just
Little
just
stiff.
Straightening up is like ooh la la.
Okay.
Okay.
Are you ready?
Yeah. So
Perfect.
we'll walk over there.
So you can...
Just gonna crack my back first. Oh my God, is it stiff today?
What it does for the patients is it really reassures them. Walk back towards me, but on your tiptoes.
CareAxis has an enormous impact on patients' lives.
Standing nice and tall. Okay. Can you walk on your heels?
So this is the balance
You're a
part.
little
This is
off balance,
way
right?
off. Crazy.
This is worse than it used to be, isn't it?
Yeah. I didn't realize it was this bad.
Yeah, it's actually worse than a month ago.
My name is Carlos Santaguida. I'm a spine neurosurgeon at the Neuro and co-founder of CareAxis. The problem we're facing is that musculoskeletal conditions are increasing in prevalence and far outstripping our ability to provide services. One study that we published with CareAxis data found that patients that were identified as potentially surgical from the primary care physician, only 20% go on to require surgical treatment. And there's an inherent inefficiency there where the surgeons are desperately needed from a healthcare system perspective, but on an individual patient encounter, they actually often deliver very little value. And so what I was attempting to do was fix this problem and make the patient trajectories a little less specialist-centered and more patient-centered.
CareAxis is really important for physiotherapists. What it does is it helps us with our clinical reasoning and our clinical diagnosis so that we're giving patients the correct information the first time. What it does for the patients is it really reassures them that they're in the right place because they're seeing somebody with advanced practice who has been trained by a neurosurgeon, and so that they know the information that they're getting is right the first time around. And for the whole healthcare system, it just makes things more efficient.
CareAxis is an access of care, but it's also an access to be able to do research. We're privileged to work with the CBIG repository to accumulate patient data and then work collaboratively in an open science format.
It's actually given me hope that there's going to be a surgery date that, 2 months later, I'll be able to continue all of my normal activities. So that is a huge gift.
When CareAxis is successful in placing the patient in a right trajectory where they have notable improvements, it has an enormous impact on my personal morale because I'm not just helping, one person directly. Now my reach is far greater, so I'm able to help a whole community of patients suffering with spine conditions.